But for many patients which are under medial pressure, their brain is washed out with this information, so they just try to make this procedure.
300 euros is the price for procedure or for the
device.
set? For device.
For device.
Quite expensive. It's much more expensive than for laser.
And flibogrip procedure that's certificated in your country, Slovakia.
We have still today no code for flibogrip, so we can't use it officially. That's the problem.
And very
total price
Yeah.
for
Yeah.
this procedure?
Excuse me?
What is total price for this procedure?
For the procedure in my private, 1,000.
1,000. So the same for as for
No,
laser?
the laser is 1,300.
For one way.
On the beginning, you need to try. You need to try if the device is working. So just flush it with a saline. Okay, it's working.
For luck.
Боитесь? Не боитесь?
Не боюсь. A little bit pain in the
In this
right
leg?
leg.
Higher,
Viņš tā uzsita tieši pa to vietu, kur...
be careful, there is a little bit pain after operation before. Yeah, right.
So that's the distal point, and we will puncture the vein here. Can you please flag? Thank you. Can you make a bigger picture with this?
Up. Okay, yeah. No. Down.
Okay, thank you. Okay, can you give me the local anesthesia? Make the local anesthesia with a thin needle and very gently. It's important for the patient, not for you. Believe it?
No.
No pain? Чувствуете что-нибудь?
Чувствую, что есть.
Frank, you speak really good Russian, yeah?
Yeah,
I'm surprised.
When I'm here in, when I'm in an environment where they are talking Russian, it comes back to me.
It just because Slovakian language is very similar to Russian, yeah? It is also
No, because we have learned 8 years Russian.
Ah, 8 years, okay.
In school.
Yeah, yeah.
But of course you can speak also German, no? Or not?
Yeah.
Weil ich glaube, da muss man auch im Prinzip, ja, Deutsch reden. Because from Bratislava to Vienna, it is really close. It is just 1 hour driving time probably, yeah? Or...
Yeah.
And I'm talking also Hungarian, because that's my mother language. Okay.
Oh, okay. Then actually you can speak in at least 4 to 5 languages, yeah? Or?
And now Frank learned
A little bit Latvian.
Latvian.
Yeah.
Love it.
Love it.
So can I ask you for a couple? Thank you. But this nurse is really talented. She's first time on the operating room and she's...
I have only because I am responsible for all my employees, yeah? And all my employees is the best what I can find in our market. Yeah?
very talented.
Evita, pero. So, you feel some pain?
No.
Not now. No?
Man visu kāju tāda sāp.
What?
Nu tāda velkoša.
What?
In the vein.
Jā.
In the vein.
In the vein.
Okay, so we take the device.
Tagad,
Then
kad
once-
viņš neko nedara.
Ну ja, jutros sam uzimala što po baksa.
Now? You have pain? You have pain?
NBC.
I'm busy. It's 1 centimeter from the junction, and here is a valve. Of course, if you just would like to change it, you can turn it and then you can go in. But now I think can you turn it, please? Just a moment. Yes, you can now go. Okay, but now you can see the hook. Turn it, please. Turn it. You can see that you can really turn the hook inside. It's a question, it's so big advantage or no. Especially in some photos when it can help you, but I think it's nothing special. Just it's here. Okay, so can we change the position, please? Is it okay for you?
Yeah.
Not
No
too much?
yet, but maybe after some minutes.
Yeah. After some minutes you will be at home.
Okay.
Okay. So to flush it gently, slowly with cold saline. It's also good for the laser. It's also good for the sclerotherapy or catheter-based sclerotherapy because you just press out the blood from the vein. Do you feel any pain?
No.
Okay. You can
Without
see.
2 minutes
You can
time.
see. Excuse me?
Without 2 minutes time, the blood is always getting back.
No, the blood is not now. The blood is not inside because the pressure in the vein is zero now. Surely, this physiology. If the patient is down with the head or in supine position, the pressure in the vein is zero. So the blood is coming just from the side of the arteries. Okay, and of course it takes a time to feel it. So I let this part here, and we have the etoxis program.
So you made flushing slow.
Excuse me?
You made slow flushing.
Any percentage of the etoxis program? This is not an etoxis program, this is just a sign.
No. Etoxis program, which percent?
2%. You need to take out the safety brake here because without this it will not work. You see in the green light 3 speeds for working, okay? And then you connect your device. 1, 2, and it's connected, okay? So please. Can you give me this slide? Here. Now is the blood here. After, because I let it open, okay? After some time it comes out. When you flush it, then it takes a time till it will be again full with the blood. Okay? So, where is the device? Here is the device. You see the device and I have catched the vein immediately, so I need to put it back.
Okay.
Tak, uspješno.
Okay, and now I start to apply the etoxis scleral.
3%?
2%. Yes, can you show them
Yes.
a picture?
Where are you?
Here. Very gently. For the speed is for 1 centimeter, 7 to 8 to 10 seconds. and for 1 centimeter I give just 0.2 mils of fluid. So it means for 5 centimeters I give 1 mil. Actually I'm using much more liquid, especially in the upper part of the vein, because that's my goal, to close the junction and to close the cranial part of the vein. It's more important like this. So in majority of cases I use the first syringe in the first third of the saphenous vein. Okay?
How you choose speed? 1, 2, 3?
I use every time the highest speed.
Do you have experience with foam? It's not liquid but foam.
Excuse me?
This is liquid or
Yes,
foam?
of course, liquid.
And
There
what
is
about
no
foam?
sense. There is no sense to do it with the foam, because the mechanical irritation will destroy the foam.
So you always need sonar assistance.
No, it's just for you.
Okay.
You can do it without control. There is only one.
Just make a stop, control it.
Yeah, you just need to listen to the rotation. If the rotation is going down, it means that you have catch the vein, and then you need to pull it back. But this excellent picture, what you can see here, is just for you. Normally we are doing it.
Actually, so.
Yeah.
I see.
So without sound control.
Yes. You control just the position of the device in the junction, and then.
It's not where it's untouching, so. Yeah.
It is like a vein massage from inside. Yeah?
Quite expensive vein.
Very special. So.
Это склероз.
Lielajiem tajā trauciņā. 3 amplas trauciņā un 3 viņš ievēl.
And of course, you can try to go back, but there is no more chance to go back because it's plastic. Okay, so then I pull out the sheet and then start again the procedure.
Tas kopā 6 samples.
Yeah.
So this retraction speed, you apply this by some feelings. Retraction speed.
No,
Pullback speed.
the pullback speed is 7 seconds for 1 centimeter, or 10. As longer you have the device in, I think. So that's, but
It is
that's
1
just my
millimeter,
opinion.
1 millimeter per second, actually. Approximately, then.
Okay. You can see that there is a spasm, that it's moving in the vein and the vein is closed around it, but I think as much mechanical destruction you can achieve, as better you have the results. And of course,
You can
if
go
it's
back now.
possible, you can do also the shaving. Okay.
It is especially for last segment you are doing this, or not?
If you can go up without any problem, but here I can't go higher. So then you can use also this.
So your choice for ulcerated legs to use this technology is because in an ulcerated area it's difficult to apply tumescence.
Yes, of course. And through the skin it's really difficult to make an incision and you know, the puncturing, so it's much more comfortable for the patient and also for you to make it reverse position, you know. Now I'm looking for the white mark here. When the white mark appears, it means that I'm 5 centimeters from the end of the device. It's very simple, so simple as it can be. Болит?
Так.
Ну так. Немножко.
Да, как будто давит.
Как бить что?
Ну,
Pressure,
Pressure.
feeling of pressure. Kura kāja bija sāpīgāka tagad?
īstenībā šī tāda vairāk. Jo tur tikai to dūrumu
It is the white mark, okay?
Bet te jūt vairāk.
So it means that now I am on the end of the device. So I press the rest of the cytoxisco to the vein.
Какая из процедур проще? Вот это или ты?
Да, было не больно.
Тут чуть не влияет.
Тут, да,
You see, I have catched the vein.
и
just for you.
позиция.
What?
Приятно.
What's her name?
Кристина.
Christina, take a deep breath. Thank you. That's just to take the focus of the patient somewhere else. This is the rotation. And now I start to apply the fluid. Just a moment.
Thank you.
Let me take her back. We have not finished. Have you the scalpel here? And here you can see a bit of material what we have sent to histology, okay? But let's look what's happened with the vein. Okay. Here is the vein, and it's not compressible.
Here?
Please.
Here?
Ah, thank you. Okay. It's not compressible, but it means nothing because it's not a laser. You know, when she stand up, maybe it will be open. You know, it's still not the same energy, the same value of the destruction. There is no evidence about transmural destruction. So she's young. She have a good spasm. It's very optimal for her. The vein is not really too big. She have enough fat on the legs. So I think it will be a good procedure for her. So if she would have a leg ulceration, then you can make it from two ports, one to up and second down, and when you stop here somewhere, and here is the leg ulceration, okay, and there you cannot move the device distally much more. So then you apply the foam through the device, foam, and from the first moment where you can start the movement, then you start a regular Clarivein. From down to up. You stop here, and then you close the vein from this side. So this is the really big advantage of this device for patients with leg ulceration. I think that this is a good indication.